Just a slight departure from previous talks. One thing that I'm particularly interested in, at the university, I work at Leeds Beckett University, I'm a researcher. So one of the areas I'm particularly interested in is telehealth and telecare in general. So technology is essentially to help us live better. Now, in the context of sustainability, there's sort of a couple of things that so occurred to me, and I was very much interested in hearing some views from previous speakers, in particular Adam Turner, because the idea behind the technologies we develop and the one I'll be talking to you about, is that we're trying to reduce inequalities in healthcare, and it's. Some of you may find surprising, but it's only relatively recently. And when I say relatively recent, I mean in the last 10 years or so. So it's not that recent, but in research terms, it is fairly recent that we have been, in a sense, as engineers, being told by those who fund our research to engage with the end users. So essentially, we need to have whoever is going to be using the particular product service you're designing should be involved in the design right from the start. And nowadays, this is very much commonplace, and most people will be surprised to hear that it worked. In the past, the idea of co-design was pretty much unheard of. And the same now, you're talking about sustainability. We just got to grips with co-design. So now I'm talking about sustainability. And I'm interested to know, particularly from people out there, is, okay, working on new products, new services, say for the NHS. And I could say straight away, well, it's going to reduce transport. That's great. But when I think about it and having listened to other speakers, well, am I just passing the buck? And is it time that now, not just co-design with the end users and the patients, we also should be co-designing with sustainability experts to ensure that whatever we come up with is not only useful to the patients or to the doctors and so on, but it's also useful in terms of sustainability and useful to our environment. So let me just talk to you a little bit.
Dorothy, just a quick one. Your microphone's cutting in and out a little bit.
Okay, yeah, I'll probably need to hold
we can hear you, but it's a bit quiet sometimes.
Yeah. So just I'm looking at the particular project I wanted to talk to you about is to support people's stroke survivors. We know that stroke is a very sort of severe condition. Increasing number of people are suffering or sort of suffering from strokes every year, and it costs the NHS quite a lot of money. So we know that it's sort of, there's definitely a need and so on. But the most interesting thing is that clinicians have come up with a sort of what they call the recommended therapy for stroke survivors, because obviously, as you probably know, most people, there's no cure, so most people will sort of, the only thing they can have is relief symptoms with physiotherapy, physical symptoms with physiotherapy. But one thing, there's been studies have found that a lot of patients out there don't actually get the recommended amount of therapy, and there are various causes for that, from simply lack of funds, lack of availability of physiotherapists, but also if you think about it, the inconvenience of the person traveling to and from the clinic to receive to participate in a session with a physiotherapist. So the whole the project we started was around building a system for rehabilitation at home, and without going too much into the details, because that's not so much a point. It's a two-way system in which the patient stays at home, box is installed, possibly next to a PC, next to the TV, and they can sort of carry out the physiotherapy that they've been instructed to do by the physiotherapist. The system automatically assesses them, so that's where the artificial intelligence and so on comes in. The system automatically assesses their movement, analyzes it, and sends the details back to the results back to the clinician who can look at it in real time or at a later date. And obviously, there are also issues of motivation. Typically, back home after intensive stay in hospital, a stroke, one is likely to be depressed and so on. So there's elements of gamification to sort of try and improve motivation and sort of just enhance general spirits. So that's the basic system. The whole idea, it's supposed to be low cost. It operates on web browsers at both ends. So from the clinician point of view, he or she can enter, pre-record exercises they want the patient to do, and the patient logs on their own side and can see what they need to do and repeat the exercises. The system monitors and assesses them. So that's a basic idea of the project. Now, one of the things we were working very closely with patients, and the one thing that really struck me was one of the ladies who we work with quite closely. At a third stroke incident, she still had not yet received physiotherapy, so had to go private. Now, this is a classic case where we are hoping to sort of, in a sense, redress the balance so that more people can have, but obviously there are caveats, as pointed out earlier. Not everybody's necessary has the facilities in their homes, although simply, in simple terms, all you need is broadband connection. Again, we cannot always make these assumptions, and there may be an element, and although in design to trying to reduce that, there may be elements of digital literacy. So there's all sorts of different issues around any such systems, and I'm particularly interested in hearing people's views about that particular. And I know there are quite a few people working in NHS and so on, but specifically in the context of this session this afternoon, the issues around sustainability. Because as I've pointed out, such a system can reduce the amount of back and forth physios traveling to patients or patients traveling to physios and so on. But at the end of the day, if the system resides in a cloud somewhere, Amazon cloud somewhere, someone else is actually using up that energy. And I think it's about time, whether it's researchers in universities, in companies, developers in companies, so on, we started thinking more closely, more clearly about the sustainability and actually including in our teams sustainability experts. There are a lot of issues around the benefits, and I rather not go into that now. Suffice to say that I welcome sort of discussion around the sustainability elements of this particular, but more generally about telecare and telehealth. So thanks very much. Any questions?
Hi, Dorothy. Ben here. I was just about to type one, but I might as well just say it. It's just more of a comment than a question, I suppose, but on your point around sort of digital accessibility for patients. I was on a digital health webinar recently looking at the explosion of telehealth in primary care due to COVID. And they said that they'd found that there was very, very little problem actually with accessibility and that people were getting to grips with the system quite easily. Now that is just for pretty simple video stuff. So I don't know if it may be a bit more complicated in your examples, but that's quite a pleasing result, I thought.
Yeah. I think things are changing now, but one of the things, I did some work with Leeds City Council not so long ago on telecare, and one of the things we found was issues around digital literacy, and that was to do with care staff. But obviously, you're talking there, obviously also different, there's a whole range of technologies involved, from the very simple to sort of more sophisticated systems that require some degree of digital literacy, especially if you have to log into any particular system and do any particular type of work.
Yeah.
I'll have a look at any questions.
Oh, look, there's one in the chat box here from Colin, if you can see it, the latest thing in the chat box.
Okay. No, I'm not quite sure. I see. Just a second.
I can read it out.
Yeah, I can see it. Yeah. Colin, following on from Jude Webb's question, would this consider using COM model, psychological model of change? Is that the question?
So,
yeah. Obviously, in such a system, it's only as good as the person using it. It doesn't matter how sophisticated it is, how well it can measure, assess, and so on. One of the things you find is that are the people that intended users actually going to use it. And obviously, there is certainly an element of that that certainly needs addressing in terms of psychological elements. Yeah.
You've got another question in there from Alexis as well, just underneath now.
So, what do so in terms of system using impact on travel, we're not yet at the point where we can actually measure that, and this actually sort of hits the sort of nail in the sense that as designers, we didn't even think about the impact on travel, measuring the impact on travel. We're only thinking about the impact on the clinicians and the patients. And quite rightly, when you think looking at the whole picture, we need to be looking at that. And this is certainly something I'll be doing. Again, yes, the second part of the question about compromised strokes. Yeah, this is the second issue. And the current system assumes a degree of capability, which we are actually now working with other professionals to look at different cases where there's more compromised. But certainly, when you're working this sort of area, there's a tendency to go, unfortunately, to go for the easiest cases, and sort of then once you've done that, you sort of start working your way through more complicated cases. But it could be that better results are achieved by tackling the more challenging straight away. So, for example, we've looked at people who've lost speech and so on, and how we can help them. Are there any more questions?
Oh, you've just got another one come in from Adam.
Patient's behavior approach of trying and using them. We've had quite good. At the moment, it's in a testing phase, and we've had quite good results. But one of the things I've been quite clear to say whenever I talk about it is that we've had the less challenging cases in the sense that when we sort of looking for users, patients to try to we approach patients to try out the system. Generally, they are highly motivated people. Quite often, more often than not, highly educated. They know exactly what they want. They know exactly how they're going to go about getting what they need. And therefore, it tends to skew your results because you're dealing with people who actually are part of the process and part of helping you. And the next challenge, the biggest challenge, is in fact dealing with people who are not necessarily keen on technology in the first place, who didn't have any particular well, maybe it could be just a phase where they're not highly motivated into looking for help for themselves. So yeah, these are very much additional challenges we're faced with. I think the next question I see is about blockchain, so it's not about me. I think I've run out of questions.
Yeah, I think that's it. So thank you.